Everybody, and welcome to the New Year, New You Facebook Live. We're very casual tonight, which is great. I'm normally in a surgical cap and scrubs. He's normally in a coat and tie, but tuxedo. But we have we've made it a little more casual. We hope that you guys enjoy this format. We used to have people come in, and this is a perfect example of why we want to do this Facebook Live, because it is raining like crazy today, and nobody wants to get out on a night like this.
Cold and dark.
Yeah, not a good travel night, and so you can just kind of cozy up with your cocktail of choice. What are you drinking tonight?
This would be a little mixtures and lemonade, kind of my closest version of a whiskey sour.
Nice. All right. So lemonade and bourbon, and I'm having water. And I don't particularly have a good reason for that, besides the fact that I operated all day and dehydrated, and my wife is forcing me to drink more water, which is a good thing. I'm Dr. Harper.
Bob Graper.
And we're here to answer any and all questions related to our practice. And if you're not familiar with our practice, we run the gamut on aesthetic procedures, on medical grade skincare, on nurse injectors that use Botox and use fillers. We've got an exciting new filler to talk to and introduce to you all tonight.
But only stuff that works.
That's right. Only stuff that works. And I have found myself over the last several weeks during consultations saying that a lot. And I think, people come in, the public is so knowledgeable. They come in with an idea of a procedure that they may think is great, or a surgery that they think is great. And then ultimately when they're here, I just kind of use that as an opportunity to educate them and let them know that there are alternatives that we have found that get better results. And there's just some avenues, some areas of cosmetic medicine and surgery that I don't think we have a great handle on, cellulite being one of those things, which is common for people to.
We've tried machines and they haven't worked, and we've tried a lot of things.
That's right.
And so we do things that work, and if they don't work, we'll tell you about them. We'll offer them to you, but we won't recommend them.
Yep, exactly. One thing that I will start off by saying, I want to congratulate my Georgia Bulldogs for their second football national championship. So congratulations to the Bulldogs. I've told my son that he's not allowed to complain if we lose any games in the year, ever, really. That's right. I waited 40 years to get another national championship, and he's gotten back-to-back as an 8th and 9th grader. So that's pretty fantastic, right? We're going to be having questions that'll be shot to my phone. That's why I'm kind of continuing to look at my phone, and we'll try to address all of these as best we can. We're also going to go through some before and afters that may kind of bring up some questions or answer some questions, but show you a little bit of our work. And then we'll talk about the other aspects of our practice that Dr. Graper and I don't do, right? We're not estheticians. We're not nurse injectors. We're not cool sculpting experts. We're not PRP experts, but certainly we know a lot about those things. And we'll touch base on any and all questions that you could possibly have. So let's start off.
Something about PRP.
Yeah.
Shockingly how good it works.
Right.
And, you pushed me on this early on, and I fought back against you because I didn't have the science. And I still don't have the science, but the results are good.
Well,
I don't like that combo, but if the results are good, I'd rather have, good results and bad science than good science and bad results.
Right. Well, you may not have familiarized yourself with the science as much because you haven't bought the book that I bought for everybody in the practice.
That's true. I've not read that
go
book.
Travel to like exotic places, and I'm sure you're not taking the PRP book with you to learn more about it.
Missed that copy.
Yeah, well, I'll put it on your desk tonight.
Thank you.
All right. We do have a question. First question is about tummy tucks. I can certainly field this one. Standard post-op lifting restrictions. For reference, you got a baby, your last of 3 big babies, and hoping you don't have to wait till they're 3 years old. No. So the first thing that I would say is the first week after a tummy tuck stinks, and there's no way around it. The main thing is because we have you using a walker and bent over 90 degrees to help increase the blood flow to your abdominal skin so that everything can heal as quickly and as effortlessly as possible. So it's not like you're going to be able to pick up a baby when you're 90 degrees over a walker. From a standpoint of exercising and holding your baby, I think, after that first week, you're going to start being more upright. You're still going to have an abdominal binder that's going to help give you support. I certainly don't want you doing any twisting exercises for the first 6 weeks. Personally, for the first 2 weeks, I don't want you to do anything that makes you sweat. Nothing that gets your blood pressure or heart rate up too much. I just don't want to risk postoperative bruising or bleeding or anything like that. At 2 weeks, I let my patients get their running shoes on and start doing some light cardio and walking as an exercise. Around 4 to 6 weeks, you're doing kind of a step up on the cardio. You could certainly do some upper body lifting, but still no core exercises until you're at that 6th week. And for me, I say 6 weeks because at 6 weeks, your tissues are 60% their final strength. At 8 weeks, you're 80% your final strength. And then it takes the rest of the year to really get that last 20%. But there's certainly no, how big is your kid? How much lifting can you do? I mean, we're all, pretty enamored with, mom muscles. Like I used to have dad muscles where I could carry the car seat in like this weird kind of cumbersome position, but my body had acclimated to it and I was great at it. About a year ago, I'm walking through the hospital and I saw a young mother struggling with her car seat. I was like, you know what, let me help you with this. This will be like my good deed of the day. So I grabbed it and we started walking towards the car parking lot. And I swear after about 25 feet, I started like changing the hands and stuff. I mean, I'd lost all dad muscles, but moms are pretty amazing. They can kind of do like a side kick and get that baby right up on their hip pretty quickly. So you're not, it doesn't mean you're not a candidate just because you have a young child, but it is good to have some help for the first week or two. And then, if we told moms you can't be a mom for 3 months, our number of surgeries would diminish drastically. So that's not the case. You can certainly get back to things. I have the difference between a tummy tuck and diastasis correction. Why don't you handle that? So tummy tuck versus diastasis correction.
Well, diastasis
how do you define that?
Is just a separation of the muscles, usually from pregnancy, but it can be from other things, lifting weights or just your normal anatomy. And it's a separation of the muscles right here where they're supposed to be attached together in the linea alba, and now they're pulled apart. So you can just correct those, and that would be appropriate if your only goal was to tighten the muscles because you don't have any extra fat and you don't have any extra skin.
Right.
That is a rare occurrence in our practice.
Very rare.
So most of the time we see people that have extra skin, some extra fat, and that separation of the muscles. And that is a normal tummy tuck, to cut the skin and fat away and tighten the muscles. For the person who comes in with just that, that's, they have the same recovery time.
It's the exact same incision too, because it's the only way, and the same dissection. So it's the only way you can get access to that separation is through a bikini line incision, lifting the skin up and then bringing the muscles together. But I talk to patients about this a bunch who maybe don't have a lot of excess skin. And I tell them, if your muscles are separated by a few inches, if we don't dissect the tissue off of your muscle, right? If we don't get in a plane that separates the skin and fat off that muscle, and we just bring your muscles together, it's going to bunch your skin in the midline and look really, really funny. So definitionally, I basically, if there's a tummy tuck, if I say tummy tuck, it's in reference to, I'm going to fix your diastasis. I'm going to fix your muscles. Otherwise, we leave that out, and it's kind of a funny word called dermalipectomy. Derma meaning skin, lipa meaning fat, ectomy meaning getting rid of. So it's a removal of, getting rid of skin and fat and not addressing the muscle issue. And there's a population of patients that don't need that. Obviously, if you have kids, you don't need that.
Right, but also I want you to make clear to everybody that you don't have to just have a diastasis. If you have stretched muscles that are still together, a tummy tuck and tightening those muscles, you do that routinely, right?
Absolutely.
Yeah. So just because you don't have a diastasis doesn't mean you don't need to have your muscles tight.
Right. And there's several rows of muscles too. And so just like when people come in and ask about Brazilian butt lifts or how to get a more rounded backside, I tell them you can't just do squats. That's only kind of working one exercise. That's only one muscle group for the rear end. So there's a series of exercises that you can do to try to gain more volume and get a nicer, rounder backside. But
is that possible?
It is possible.
So somebody who starts off with a bottom that
Yeah.
everybody would say is not as optimal.
Sure.
Because I think of bottoms as muscle and fat distribution.
Right.
And so can you exercise your way? Now, if you've got a great bottom that's just a little flabby, can you exercise the way into it? I suspect you can.
Absolutely.
But if you don't have the fat position correctly, can you?
I would say there's some pretty good rear ends out there that don't have a lot of fat on them, right? And so I can tell you that one of our estheticians has really transformed her figure in the last 5, 6, 7 years. And if a patient has a question about that, I grab Melissa and she goes and talks to them about, here's the book that I use, this is what I do. But doing exercises that work all three of your gluteal muscles can help. Now, it's not going to change your hip width and your waist to hip ratio or anything like that, but it's analogous to the abdominal muscles. And so people that may not have diastasis but don't have the flatness they want may not be using their obliques and working their obliques the way they need to. So there's series of exercises that will work all those muscles besides just a sit-up, which
that'll enhance surgery.
That's exactly right. When a standard sit-up will make your diastasis worse. So people really have to be worried about that. How long after a breast reduction surgery do you recommend lymphatic massage therapy? That's a great question. And I personally feel like lymphatic massage therapy is something that I've just kind of adopted over the last, 3, 4, 5 years, probably as a strong kind of adjunct to the healing process for my patients. So we have several that we use, that we send people to. I typically tell patients, you're not going to want somebody touching on you even lightly for the first week, maybe the first 2 weeks. But a lot of these places are booked out. So it's important to kind of, even before surgery, maybe have somebody on the books for 2 weeks after surgery. But I don't know if you do it any differently or anything like that.
I sort of don't do it a lot.
Yeah.
I don't know if that's going to be the popular response now, but what I found is at 3 months, you can't tell the difference.
Oh, correct. No, I totally agree.
If there's a cost involved and it ends up being the same, I just tend to say, I
think on a long enough timeline, all things kind of even out. But I do think that it does expedite getting rid of some of the fluid in patients. I think that it helps get their lymphatics flowing, get their swelling down. And that also can kind of psychologically, for a lot of my patients, add to the fact that they are improving, that they're getting better, that they can feel. Because we all know that after surgery, you're going to swell. So when we do a tummy and some liposuction and a patient comes back after the first week and says, I weigh more on the scale, I'm like, what were you doing on the scale for the first? I mean, you're obviously going to retain water and it's going to be water weight. But I think psychologically it has benefit. I think physically it has benefit. Depending upon the surgery, but
your patients get great results, so it's working.
I think so. I think especially for the liposuction patients, I think that it works out some knots. I think it helps even out some areas that can get little ruts in them from where swelling can increase, because liposuction isn't an exact science. So
not even close.
Yeah, so pushing the fluid out of that area can really kind of improve the way that their body feels and the way they fit
your
into
garment needs to fit appropriately, because
Yep.
you can create grooves, and your postoperative result that early on we thought that'll just go away because it's swelling, but if the garment doesn't fit properly, that groove can stay there. So and lymphatic massage may help that, and appropriate fitting garment is essential.
Right. Okay. Another question, and then we'll get to the first set of pictures, but we will get to all these questions. Talk very briefly, because I think we could talk very briefly about teardrop shaped breast implants and why we don't use them.
Well, because teardrop shaped implants have to be textured, and we don't like textured anymore because the LCL issues. And the smooth shape has worked great forever. A lot of people never adopted the teardrop shaped implants because you couldn't really tell the difference. I was one of those guys that just said the round is fine. We're back to round now. They look great. You don't have any safety issues at all. And, for me, it's a non-issue.
Yeah, I agree. I enjoyed kind of the idea of having a more natural appearing breast implant. And for me, when the shape devices came out, I think it filled that void. What I think I've learned as I have operated more and more and kind of been there is, we can make decisions with the round devices that can make you look just as natural. I actually remember something that was kind of eye-opening to me is this weekend is a major breast meeting symposium in Atlanta. It's the breast symposium. And so when I was at Emory training, I had the good fortune of being asked to operate with some of my attendings every year that we were there. And in one case, I was with an awesome breast surgeon in Atlanta. And on one side, he put a shape device, and on one side, he put a round device. And then he had everyone in the audience, because it was live, it was broadcasted.
Which one was which?
And it was 50-50. Like nobody knew. And so I think if you use the right implants, you can get all the pros and none of the cons of the textured teardrop shaped implant. So I haven't used a textured implant in a long, long time, even in reconstruction stone. There was a question real quickly about, yes, when we have the giveaways for tonight, it will be on Facebook as well as Instagram. You don't have to be an Instagram follower or anything like that. Another was kind of the timing of diastasis repair, right? So if a lady just had a baby 2 months ago and she's looking down at her tummy and she says, oh, it's just a wreck. Like, I mean, when do you tell somebody it's okay to be a wreck? Like, give it
at
time.
least a year.
Yeah, and I think,
and a year after your last baby.
yeah, and I think that's good. I think that's good advice. Everybody's different, right? I mean, we've got a nurse here that all the girls hate behind the scenes because she has a baby, and then like 2 weeks later, Lori Lee looks awesome, right? She's got like a flat stomach, and so all the girls hate her. For that, we love her, but certainly don't like that. And then some people take longer, and some people never get back. I mean, we have some people that are extraordinarily fit, that are 2 years out from having their baby, that are their BMI is like athlete.
20.
Yeah, it's like insane. And they look 9 months pregnant. And so it just never kind of goes back. And so it's also interesting how many times somebody comes in and says, I did great after